You're watching Formosa News. I'm Ken Lee. Welcome to the program. 2 new imported cases of COVID-19 were announced by the Central Epidemic Command Center on Sunday. Concerns about community spread of the virus are still increasing after it was found that a man who eventually tested positive for COVID was part of the Taoyuan General Hospital cluster, but at the time he didn't know it. He was feeling unwell and visited another hospital in Taoyuan. There, he infected a man in a waiting room after sitting near him for less than 15 minutes. An expert says Taiwan is at great risk of community transmission, but it's not gotten to the point where it is out of control.
The entrance to the hospital was deserted, and on Sunday few people were coming in and out of the building. It's emerged that at this unnamed hospital in Taoyuan's Pingzhen District, a man, case number 908, accompanied by his mother, sought medical attention. He happened to be in the same waiting room as case number 889, a man infected with COVID-19 from the Taoyuan General Hospital cluster. They were only in the same place for 10 minutes or so and both had masks on, yet he still managed to get infected by the virus. The source of the infection is very clear. When case number 889 was in the area, the 2 people were sitting relatively close. The 2 of them couldn't have been in contact for more than 15 minutes. CECC Chief Chen Shejung said the 2 were sitting in 2 different rows of seats that were close to each other. Experts point to 2 possibilities as to how the man contracted the virus. Sometimes in just a few seconds or minutes of contact, if you just inhale droplets exhaled by the patient, of course you can get infected. If someone infected with the virus touches a certain place like a doorknob, desk or chair, then you touch it, then you could be exposed to the virus. On the same day after the diagnosis was made, a large-scale disinfection was carried out in the evening. If we discover anything in the area where we detected this, I will tell you about it. Experts believe Taiwan is at great risk for community transmission of the virus, but it's not got to the point where it's out of control. Over time, we see that some patients have tested positive, but before they became ill, they were unaware of their condition. Some went into the community or to other hospitals. Currently, there is a great risk of community transmission in Taiwan, but we don't consider it a community transmission that is out of control. Aware of the health risks, the CECC has expanded the list of people who came in contact with the first man from the Taoyuan General Hospital cluster by adding on 130 people. All of the friends and 4 family members of the second man, including his mother who accompanied him on the visit, have all tested negative for the virus.